So today I'm going to speak about phobias. What is a phobia? A phobia is an overwhelming fear of an object, place, situation, feeling or animal. Fearing something is normal, but if it interferes with daily life and functioning, then it is considered a phobia and may require treating. There's different types of phobias, and according to the DSM-15, there are three categories. There is the fear of open spaces, which is agoraphobia, social phobias such as talking or eating in public, and there's specific phobias which can be fear of water, fear of heights, or fear of certain animals. Symptoms do not normally show unless they come into contact with a phobia itself, or sometimes even thinking about the phobia can onset following symptoms such as nausea, sweating, increased heart rate, shortness of breath. There are different types of explanations for phobias, such as psychological, social, and biological explanations. In psychological, there are also three different explanations, such as the behaviourist, the psychodynamic, and the cognitive. The behaviourist explanation is based on the view that the behaviour is learned and therefore can be unlearned. Fears are formed by classical conditioning and maintained by operant conditioning. Fear of objects, animals, and situations can be formed by association. Specific phobias are caused by the association between a previously neutral stimulus and the fear response. This is called a conditioned response. This is supported by the Pavlov's work with his dogs, with his classical conditioning discovery. And Watson and Rayner also conducted a laboratory experiment to examine whether a fear response could be learned through classical conditioning in humans. This was proven with little Albert, an 11-month-old child, was shown a rat. At the same time, they struck a metal bar with a hammer behind little Albert's head, causing a very loud noise every time he went to touch the rat. They did this 3 times, and after the 3rd time that they showed Albert the white rat, he began to cry. The experiment showed that the fear response could be induced by classical conditioning. Little Albert also developed a fear towards similar objects such as Santa Claus's beard and other white furry objects. This experiment has major ethical issues due to Albert being unable to give consent and also unable to realise that what he was taking part in was controlled research. Classical conditioning works well for explaining how phobias might be formed, but not why they might be maintained. The study of little Albert supports the explanation that fears can be acquired by a conditioning process. However, just because it can be demonstrated that some fears can be acquired this way, it does not mean that all fears are acquired this way. People can relate to their phobia to a specific experience. So 56% of people with a fear of dogs can relate their fear to a frightening experience with a dog. This supports conditioning theory, but does not account for the people those that do not recall a bad experience. It does not also explain why some people in the control group reported a painful incident with a dog but did not develop a fear. So it does not explain why some people develop a phobia and others do not. So it ignores individual differences. It's also too focused on the role of nurture and ignores the evidence on biological effects. Attempts to copy the Watson-Rayner study have been unsuccessful, so the theory may lack reliability. In the psychodynamic explanation, Freud suggested that phobias arise when anxieties are displaced onto the phobic object that symbolises the initial conflict. The ego is threatened by unconscious conflict and fears that the anxiety caused by the conflicts will overwhelm it. The whole of the ego's energy is being used to cope with the anxiety and panic that the ego may not be able to function at all. To cope with this, the ego uses the defence mechanism displacement. The anxiety is displaced onto another object or situation, which results in a phobia. He used the classic study of little Hans to illustrate the process. So Hans developed a fear of horses because a horse represented the boy's unconscious fear of his father. He was also afraid of being bitten by a horse, whereas he was actually scared that his mother would leave him. But data collection, such as studies, relies on retrospective recall, which may be unreliable. Such data is correlational and does not demonstrate a causal link. The explanation of Hans' phobia is complicated. It was found that at age 4, Hans had seen a horse collapse in the street, which upset him. So this could support the behaviourist classical condition explanation for his fear of horses. Therefore, the psychodynamic explanation lacks falsifiability. The approach seems unscientific, as it is very difficult to quantifiably measure something that is happening in another person's or your own unconscious. Freud suggested that adult phobias only occur to people with sexual problems. However, many people with phobias have a normal sexual life. In the cognitive explanation, it's the fearful response is experienced due to the interpretation or appraisal of events. It is the interpretation of event that triggers the emotion, not the event itself. Phobias Phobias form and persist due to three main factors: sensitization, avoidance, and irrational or negative thought processes. Phobias may be the result of irrational thoughts. For example, the sensation of crowding in a lift may develop into a cognition that lifts are associated with suffocation. Isaac reports research on biological challenges, such as breathing in a mixture of carbon dioxide and oxygen, which provokes a panic attack in patients suffering from panic disorder of agoraphobia, but rarely in normal controls. The success of behavioural and cognitive behavioural therapies in treating phobias supports their value as explanations. They accept fear can be learnt, but also emphasise on the person's own interpretation of events, which presents a more holistic explanation than others. This explanation is scientific and objective because psychologists conduct experiments to identify the different thought processes of those who have a phobia and those that do not. However, behaviour is not always caused by cognitions. Evidence has suggested that cognitions can be driven and or maintained by inappropriate behaviour such as avoidance. Meaning behaviourist ideas can sometimes be more effective for explaining a phobia. The social explanation is that phobias could develop as a result of watching another person experience pain, upset, from a object or situation, such as classical conditioning, operant conditioning, and the social learning theory. Fears can be learned through imitation. There was a study that found that monkeys could develop a snake phobia simply by watching another monkey experience fears in the presence of a snake. A child may also develop a fear of dentists after watching their mother experience fear and pain in the dental surgery. The problem with this is that some fears may be innate, and not everyone who is exposed to conditioning develops phobias. For example, the dog study by Donato et al. Found that as many people without dog phobias as those with dog phobias reported negative experiences with dogs. And we come to biological explanations. So some people are more susceptible to developing a phobia than others, and therefore a genetic explanation has been proposed to account for these individual differences. These can be viewed by genetic or evolutionary explanations. In genetics, individuals may inherit a genetically determined predisposition to develop phobias. This is supported by twin studies conducted by Torgerson, who found that 31% concordance for panic disorder with agoraphobia in MZ twins versus 0 concordance in DZ twins, though none of them shared the same phobias. It is also supported by family studies by Sohn et al. Found that 45% of phobic patients studied had a family history of the disorder, compared with 17% of the normal controls. In evolutionary, it's suggested that fear and anxiety are adaptive responses. A fear becomes a phobia when it interferes with normal functioning. The hypothesis of biological preparedness by Seligman suggests that we are biologically prepared to be conditioned to fear certain objects or situations that were dangerous to our ancestors. Snakes, spiders, and other animals would have once posed a real threat to hunter-gatherers, for instance. Fear of heights would also increase the survival of an individual, which explains why people acquire certain fears more readily than others, such as a fear of snakes rather than a fear of fast cars. This can explain why it's difficult to separate nature from nurture when considering the causes of phobias. It's possible that both are linked, and it can explain why these behaviours have developed for a survival purpose. Evolutionary studies are supported by experimental evidence in humans as well as animal studies, and it uses aspects of both behaviourist and biological ideas, so a more holistic explanation for the formation of phobias. Kendler et al. Concluded that specific phobias have only a small genetic component, whereas agoraphobia seems to be more related to genetic vulnerability. The concept of biological preparedness cannot explain fears of harmless situations or things, however, and studies on fears have been criticised for ecological validity due to being investigated in a laboratory condition, meaning laboratory fears are unlike phobias that people would have in the real world. So there are different treatments for phobias. Many people with a phobia don't need treatment, and avoiding the object of their fear is enough to control the problem. However, it may not always be possible to avoid certain phobias, such as a fear of flying. Most phobias are curable, but no single treatment is guaranteed to work for all phobias. In some cases, a combination of different treatments may be recommended. The main treatment types are biological and psychological therapies. Biological therapies include drugs, which anti-anxiety drugs work on the neurotransmitters in the brain to produce a reduction in the autonomic nervous system arousal associated with panic. The most commonly used drugs are effectiveness and evaluation of drugs. Some drugs are highly effective and fast working, within 30 minutes, which is great for those that suffer from panic attacks. Drugs for phobias or acute anxiety should only be used for short term if the person is feeling unwell and unable to cope. Drugs can become very addictive and have withdrawal symptoms too. And with all drugs, they have side effects and complications which can actually make the symptoms worse and increase anxiety, agitation, hostility, and aggression. It should be understood that they only lessen the symptoms for the disorder and they are not a cure. Therefore, the effectiveness of drugs aren't that great. There's another biological therapy called biofeedback, and this is a form of which works in conjunction with relaxation in order to help control the effects of stress and anxiety. The idea is that if one can teach oneself to relax, then the heart rate will come using the body's own inhibitory systems to reduce the physiological effects of panic. Biofeedback therapy teaches relaxation and mental exercises that can alleviate symptoms. The therapy is non-invasive and inexpensive, and if the person is able to relax enough to learn the technique, then it is extremely effective. The problem that it is to be effective, it requires practice and commitment on the part of the sufferer. They need to have the insight to understand that they are not physically ill. They can control their ANS actively by relaxing. In psychological treatments, there are the behaviourist therapies, cognitive behaviour therapies, and guided image therapy. In behaviourist therapies, behaviourists explain phobias as a learned association between a certain stimulus and a certain response. Behaviourist therapies will therefore try to reduce the strength of these associations. There are two methods to trying to do this: systematic desensitisation and flooding. In systemic desensitisation, this involves gradual exposure to their phobia whilst being taught on breathing and relaxation exercises. The aim is to lower the patient's heart rate as they go through various stages. The effectiveness of this is that it shows it's very effective for specific phobias, supported by empirical evidence. Systematic desensitisation works well in the therapeutic situation and is quick and inexpensive, although it is difficult to use with more generalised social phobia or agoraphobia because the environment cannot be carefully controlled. It's difficult to put into place and only useful for certain cases, for example, for suitable phobias of snakes and spiders, but not for generalised social phobias. In flooding, like systematic desensitisation, flooding also exposes the patient to their phobia, but in a more intense form. This overwhelms the individual's senses with the item or situation that causes anxiety, so that the person realises that no harm will occur and in fact there is no need to fear. In modern times, there is virtual reality exposure, which is a way to expose the patient to visuals of the phobia in a controlled environment. The effectiveness of this is that it is important that the real-life exposure is more effective than an imagined exposure. It is important that the physical health is at a good level due to strain on the heart. The virtual reality has advantages over systemic desensitisation as it is much easier and cheaper and more convenient, but it still has similar levels of success. It can be effective if the patient is willing to put themselves through the stress firsthand, however, many are not. It also raises ethical and practical issues. Flooding produces high levels of fear, and this can be very traumatic. Equipment for virtual reality is expensive and may not be suitable for all phobias. In cognitive behaviour therapies, this can replace unrealistic and fearful thinking about phobias with more realistic mental habits. It teaches patients to identify a challenge and replace counterproductive thoughts with more constructive thinking patterns. The aim is to help the client to see that their thoughts are irrational and not based in reality. These can include modelling therapy and cognitive behaviour therapy. Modelling therapy is a way of unlearning a phobia by watching someone else handling the phobic object or situation and not be harmed, which is known as vicarious reinforcement. The effectiveness is very quick. They take on average a few weeks or months and be even accomplished in 1 or 2 sessions. There's very few side effects and there's no dependency problems that are associated with drug treatment. They're very effective according to research findings, and they're very useful in combination with other therapies such as drugs. Modelling therapies has been proven to be effective with children who have dog phobias and adults with snake phobias. However, it's not certain that it will be cured forever. Some phobias may return depending on the level of trauma that may have occurred during childhood. Therefore, there may be underlying issues that might need to be resolved with a therapist. In cognitive behaviour therapy, CBT, it changes the client's perception by identifying negative irrational thoughts that are leading to the phobic reaction and replace these rational positive ways of thinking. In cognitive restructuring, it reviews irrational beliefs and expectations, develops strategies for coping stress and anxiety that are more rational. The client identifies automatic, negative or distorted thinking. Whereas cognitive rehearsal, it mentally goes through the events that are anxiety provoking, rehearsing elements of behaviour in situations with a positive outcome. This works effectively when the patient-therapist relationship has mutual trust and respect. Patients are less likely to relapse than those given biological treatment. A lot of empirical evidence to support cognitive therapy for anxiety disorders, and it's useful for rehearsing situations that cannot easily be clinically simulated. It helps to reduce anxiety and potential difficult situations for that individual, and it's cost-effective and has quick results. The negatives are that though it's argued that it does not get to the root cause of the problem. A more qualified therapist is needed to have high levels of success, which may cost more than the less qualified therapist. And it's not clear that what element of therapy is most effective. It could be another factor, example, medication or lifestyle change, and not the intervention by the therapist. Another type of therapy is guided image therapy, which includes neurolinguistics programming, clinical hypnotherapy, mindfulness and meditation, and yoga to help reduce anxiety. Neurolinguistic programming aims to break the cycle of negative initial impressions to alter how our brain interprets information. This is done by altering the neurological filters relating to the information by changing the perception of the material and putting the client in control where and how they visualize the material. The therapist will then help to alter the cognitive processes to generate new behaviors. The effectiveness of this is that it can be used by practitioners in different fields and contexts. NLP has not been subject to the same standard of scientific rigor as therapies like CBT, so it lacks formal regulation. It means that claim of its effectiveness can be anecdotal or supplied by an NLP provider. There's a lack of formal body to monitor means that methods of quality of practice can vary. More impartial evidence is needed to support its effectiveness, and practitioners may prefer to use other trusted methods for treating phobias. This clinical hypnotherapy is used as guided imagery and breathing exercises to completely relax the patient to the point that they're in a peaceful trance-like state. Beneficial corrections may be given directly to the unconscious mind. Hypnosis can contact our inner unconscious self, which is both a reservoir of unrecognised potential and knowledge, as well as being the unwitting source of many of our problems. Hypnotherapy is great if the patient-therapist relationship has mutual trust and respect. This allows for the patient to completely relax and see best results. There are fast phobia cures and can be obtained in one session and are often very effective treatments for those who are able to accept hypnotherapy as a treatment. It's an evidence-based therapy with over 70,000 research references worldwide. It's cost-effective and has quick results. It also can be successful where other interventions have not produced the desired outcomes. Another form is mindfulness meditation therapy. So this is based on the principles of progression, muscle relaxation, yoga and meditation. It promotes positive thinking and enhanced well-being. The effectiveness of mindfulness meditation is that studies in brain imaging scans have shown its effectiveness for anxiety problems. Patients can practice in the safety of their own home using apps like Headspace. However, this is not controlled by a specialist. The aims to get to the root of the origins and the disorder could help the longevity to reduce symptoms. Although it does not take into account the biological mechanisms, and it requires a lot of commitment and practice. It also requires skill and empathy of the therapist for best results, and the client also needs to have a level of understanding of their condition for willingness to want to change their behaviour. All in all, the effectiveness techniques by cognition intervention that is based on well-founded neurological processes. Guided imagery is more effective, more specific, for more specific phobias in either cognitive restructuring or graded exposure therapy, showing lasting results for up to 6 months. This makes it low cost and quick results, to make it more affordable for clients as it is not yet readily available on the NHS.